Hey guys, my name is Nicole. For my presentation for this semester, I'm going to be teaching you guys about Tamsulosin, which is also called Flomax. So I hope you guys enjoy it and learn everything about Tamsulosin. Thanks. So on this slide, I will be telling you about Tamsulosin, which is also called Flomax, classification. So Tamsulosin is in a class of medications called alpha blockers. There is no assigned therapeutic classification. Its pharmacologic classification is a peripherally acting antiadrenergics. Its action is it decreases contractions in the smooth muscle of the prostatic capsule by preferentially binding to alpha-1 receptors. Its therapeutic action, it decreases symptoms of BPH, which are signs of urinary urgency, hesitancy, and nocturia. So Tamsulosin basically helps relax the smooth muscles in the prostate and the opening of the bladder. So here are some adverse reactions and side effects to Tamsulosin. You'll see orthostatic hypotension, rhinitis, priapism, retrograde ejaculation, dizziness, headache, back pain, diarrhea, feeling tired or weak, and throat irritation. So, orthostatic hypotension is more common when you first start taking Tamsulosin or when your doctor increases your dose. It can also happen when you stop and start back on Tamsulosin. Some nursing implications that we would do for our patients that are taking Tamsulosin or Flomax. We would assess the patient for symptoms of BPH, such as urinary hesitancy, feeling of incomplete bladder, urgency, difficulty starting a stream, or dysuria. Assess the patient for first dose of orthostatic hypotension. Like I stated in the last slide, orthostatic hypotension is more common when you first start taking Tamsulosin. We're going to monitor eyes and nose and daily weight, and we're also going to monitor for edema daily, because if this drug is not helping our patient, then we could possibly see them retaining urine or fluid, which could cause edema and weight gain. So some education that we would provide to our patients that are taking this drug, we're going to tell them to take the medication as directed even if they start feeling better. We're going to teach them to change positions slowly and avoid driving until they know how this drug reacts to their body. Let them know that this drug may cause abnormal ejaculation, including ejaculation failure, ejaculation disorder, retrograde ejaculation, and a decrease in ejaculation, which may impair fertility. These symptoms are reversible when the medication is discontinued. We're going to tell them to report any rapid weight gain or edema, and it's very important that they take 30 minutes after the same meal each day. Taking Tamsulosin on an empty stomach can cause your body to absorb too much of the medication, which raises your risk for side effects. So this is why it's important to take it with your meals, 30 minutes after your meals every day. Remember that Tamsulosin can lower your blood pressure, so be cautious when taking this along with other blood pressure medications. So why do we give Tamsulosin? Patients are prescribed this drug to treat signs and symptoms of an enlarged prostate, which is also known as benign prostatic hyperplasia, or BPH. So what is BPH? BPH is a prostate gland enlargement that compresses the urethra, causing overt urinary obstruction. epithelial and stromal cells proliferate and accumulate, leading to enlargement of the gland, which may extend into the bladder. So basically, it's the compression or distortion of the prostatic urethra that obstructs urinary flow. Some risk for BPH would be men over 50, have a family history, men who are overweight or obese, men who are not active, or have erectile dysfunction. The cause of BPH is unknown but possibly linked to hormonal activity. Approximately 50% of males older than 60 and more than 80% of males age 80 and up exhibit signs and symptoms of BPH. So here are some signs and symptoms of benign prostatic hyperplasia. Weak urine stream, frequent urination, dribbling after urination, having the urge to urinate, and urinary incontinence. So what if the patient needs surgery for BPH? A transurethral resection of the prostate, also called a TURP, is a common surgery for BPH. TURP uses an electric current or a laser light to cut and remove tissues. This surgery is done under anesthesia, and a tool called a resectoscope is inserted through the penis. After a TURP, the patient may need a continuous bladder irrigation, or a CBI, to help prevent or remove clots after urinary surgery. So if you look on the next slide, I have a picture of a man with a continuous bladder irrigation, and I will also post a video of myself with some props that I have and explaining the process of a CBI. Okay, so in the picture you will see an example of someone with a continuous bladder irrigation going, and as you can see in the picture, for the continuous bladder irrigation they need a 3-way Foley. So I have an example of one here. Obviously this will be placed sterile. Usually at the hospital I work at, our urologist comes and places the 3-way Foley and starts the continuous bladder irrigation for us. So this one here, you would hook up your flush to inflate the balloon at the end of the Foley, and then the middle one is hooked up to the Foley bag that the urine drains into, and the third one is hooked up to the 3000 cc saline bag that is usually hung up on a pole. So I'm just going to show you guys, hopefully you guys can see that. It's just a normal Foley catheter with 3 inserts. Nothing too special about it. And while I'm in this video, I just wanted to show you guys a little picture that I drew. Hopefully you guys can see this. So just about BPH, as you can tell, this one would be a normal prostate, and then this one is what a prostate would look like when someone has BPH. It's very enlarged and swollen here, which could block the flow of urine. So if your patient calls complaining of negative side effects, here are some things that we can tell them. It is very rare that people taking this drug have major side effects, but it's also not impossible. If the patient calls the doctor's office saying they are having negative side effects after taking this drug, what do we tell them to do? So first, we will tell them to seek medical help right away if necessary. They will need to call 911 or go to the ER. If it is something that could be addressed in the office, we will make them an appointment ASAP to discuss the issues. They may be advised to stop the drug or start it on a different drug by the doctor, but we want to remind them to not stop the drug unless told to do so by the doctor. So here's a practice question. When evaluating the effectiveness of Tamsulosin, which information will the nurse obtain from the client? The answer is the last one, having trouble starting the stream or dribbling of urine. So tamsulosin relaxes the smooth muscles of urination in order to promote outflow of urine. This results in a stronger stream that is easier to initiate and is sufficient to empty the bladder. When caring for the client taking this med, the nurse will evaluate effectiveness by assessing for these findings. The client's report of urination is important when assessing medication effectiveness. So here are my citations for this PowerPoint. I hope you guys learned a lot about Flomax and BPH and TERT, and I hope this can help you educate your patients better that are taking this drug. Thanks for watching.